Hi, my name is Marie and I'm from Norway, but I live in Madrid, Spain, where I work. I'm a psychologist, but I'm also specialized in sexual therapy. By talking about sexuality, we have to start by defining some really important terms. So, sexuality, to begin with, is maybe one of the central aspects of human throughout life. It encompasses sex, gender identities and roles, sexual orientation, eroticism, pleasure, intimacy, and reproduction. Sexuality is experienced and expressed in thoughts, fantasies, desires, beliefs, attitudes, values, behaviors, practices, roles, and relationships. While sexuality can include all of these dimensions, it does not always express, we don't always express or experience all of them. It can be influenced by an interaction of biological, psychological, and social factors. Another important term is sexual health. What is it really? Well, it's defined by the World Health Organization as a state of physical, emotional, mental, and social well-being in relation to sexuality. So, as many people think, it is not merely the absence of disease, dysfunction, or infirmity. It does require a positive and respectful approach to sexuality and sexual relationships, as well as the possibility of having pleasurable and safe sexual experiences, free of coercion, discrimination, and violence. The sexual rights of all persons must be respected, protected, and fulfilled for sexual health to be attained and maintained. Lastly, sex is another important term to define. Like I mentioned before, we have sex, we have gender, and we have sexual orientation. But while talking about sex, it refers to the biological characteristics that define humans as female or male. The two are not mutually exclusive, as there are individuals who possesses both. I'm sure you heard about sexology, but do you know what it really is? So it is the scientific study of human sexuality. It includes sexual behavior, sexual attraction, and sexual identity. It also studies how the sexuality affects other areas of the life, like physical health, society, and also psychological health. It is a multidisciplinary field, so it's based on different sciences like psychology, sociology, anthropology, biology, and medicine. It also considers things like cultural history, religion, and ethics. Talking about sexual therapy, how is it really done? So it's carried out by a clinical sexologist or a sexual therapist. It focuses on improving sexual health and well-being, preventing sexual risks like sexual risk behaviors, and also problems related to sexuality, and providing the correct information about sexuality. It is specialized in the study and treatment of people's sexual problems. So sexual therapy, it can be beneficial for people of all ages, all genders, and sexual orientations. It is a process that involves open and honest communication between the therapist and the individual or couple that comes to therapy. The therapist will work with the individual or couple to identify and address any underlying psychological or emotional issues that may be contributing to their sexual problems. In addition to addressing specific sexual problems, sexual therapy can also help individuals and couples develop a more positive and fulfilling sexual relationship. This can include improving communication and intimacy, enhancing sexual pleasure and enjoyment, and addressing any conflict or difficulties that you might have in the relationship. Do you know why it is important to study and treating sexual health? So having difficulties or problems related to one's sexuality, it affects our physical, psychological, and social health. It can lead to psychological problems such as anxiety, low mood, like depression, eating disorders, addiction of legal or illegal substances, and a lot of other difficulties and problems. A sexologist is an expert with knowledge about sexuality. A clinical sexologist or a sexual therapist is moreover trained in therapeutic skills and in how to apply that knowledge to treat problems related to sexuality. to have knowledge about sexuality in all ages, sexes, genders. The knowledge is about anatomy, pleasure, sexual dysfunction and problems. It also includes sexual traumas, guidance within sexuality, sexual history, and a lot more. Clinical sexologists might have a different background when it comes to their education. So they can be a psychologist, they can be trained in education, they can be a doctor, also a nurse. So it has to be in a health-related or educative related area. So when you seek a sexologist, you're completely allowed, it's perfectly fine to ask them about their background to better fit your needs. But either way, all of them learn about sexuality from a multidisciplinary field, like point of view. So you know that they include important factors like biology, psychology, social and cultural aspects. Anyone can seek therapy and anyone can seek help from a sexual therapist, regardless of age, gender, sexual orientation, and relationship status. You can either come by yourself or come with a partner. I'm going to list the most common issues that are brought up in sexual therapy. We have the lack of sexual desire. We have difficulty becoming or staying aroused. We have erectile dysfunction or difficulty achieving or maintaining an erection, premature ejaculation or difficulty in delaying it, difficulty achieving orgasm, pain during sex, during penetration, sexual anxiety or performance anxiety, difficulties with communication and intimacy in the relationship. We have concerns about sexual orientations or gender identity, unresolved past sexual trauma or abuse, concerns about sexual fantasies. This is important. As long as we don't act on the fantasy, we're allowed to use pretty much anything in our imagination. There's also the fear of committing to one or several persons in relationships, faulty expectations for sexual activity, and this is often caused by pornography, because it gives like this false perspective of what is really a sexual relationship or sexual relations. There's also the desire to explore new sexual activities in a safe manner. And this is often something brought up in BDSM, that many people, they want to explore it, but they don't know how to do it in a safe manner. And this is really, really important. So these are just a few examples of what issues can be really addressed in sex therapy. But in the end, any issue that affects your sexuality, sexual experience, or relationship can be addressed in sex therapy. And you don't need to have a problem with any of these. It can also be to improve or to learn how to enjoy it more. Have you thought about seeking sexual therapy? Well, this is what you can expect when you first get there. So during sexual therapy, you can expect to talk openly and honestly about your sexual expressions, experiences, concerns, and goals without prejudice. Your therapist will listen to your concerns and help you identify any issue that might be affecting your sex life or your sexuality or your sexual health. A clinical sexologist should be able to understand, guide, and help people who struggle with problems related to sexuality. And I repeat, it's a place where you should feel safe, where you can be honest, and where you will not be judged. When you come to do sexual therapy, you can expect the therapist in the first session to ask you the reason why you chose to seek therapy, and they will also explain to you how the therapy usually works. So basically, it is divided into 4 different stages. The first stage is about evaluation and assessment, where the therapist will ask you a lot of questions. They might even send you some tasks that you can fill out at home so that they get a bigger idea of what is really going on in your life, also outside of therapy session. In the second part starts when the therapist feel they have enough information. So they will dedicate a session to give back that information so you know what they're really doing with it. And they will explain sometimes the origin of why you're having these difficulties, and then why it's being maintained. At the end of this session, based on that information and your objectives, they sit down together, the therapist and the client, to discuss different objectives that they want to reach in therapy. So these objectives are very specific, but they are also flexible. So you can add more objectives throughout the therapy, they can be changed, and you can also have a say in which order, like what you want to prioritize. Once this session is done, we go to the third stage, which is when we start with intervention. So the intervention, it can include different parts. So it can have different techniques that the therapist will teach you, and then you can practice it in session. And then outside of session, you would practice it more, and then the therapist can make small corrections in the next session. It also includes information. In sexuality and sexology, there is a lack of education in our educational system. So this trained specialist will give you the correct information. And when the changes are starting to become more maintained over time, the therapist will leave more responsibility to the client, and they will start to space out the sessions. So in the beginning, it's normal to have sessions weekly, but then they will move over to having them bi-weekly. And when it's being even more maintained, you might have one session and then the next one in a month, just to see that it's still being maintained, that the changes are working out, and if you have any questions or something that you want to talk about. And in the end, when all the objectives are met or almost met, we end the therapy. So in a first session, you can expect that the sexual therapist will ask you a lot of questions about your sexual history, about previous relationships or current ones, but also it is important to disregard any biological explanation for the problem. This can be done through questions, but also through like a medical appointment. And then in the other sessions, like I mentioned, it's back and forth communication, sometimes teaching, and always assessing. If something new comes up, you can always bring it. The information you give, of course, is also confidential, so the sexual therapist cannot share it with anyone else. And also, you should never be pressured into sharing information that you don't want to share. But again, the more information the therapists have, the more they can help you. But if you don't feel comfortable the first session, you can wait to tell about it later on. Like, no pressure, it's your space and you should feel comfortable there. So it can be either conducted individually or with a partner. This depends on your specific needs and goals. The number and frequency of sessions will vary depending on your individual situation and progress in therapy. First of all, you can expect to discuss your sexual history, experiences, and goals. Explore the emotional, psychological, and relationship factors that might be affecting your sex life or your sexuality. Develop strategies and techniques to improve your sexual experiences and relationship. Address any concerns or misunderstandings you might have about your sexuality. And also improve communication with your partner or partners about sexual issues. If the sexologist cannot help you, they will help derive you to another health professional or a sexologist who's more specialized on that specific problem. Since a sexologist can have different background in either medicine, psychology, or education, you might need to be derived to another professional. So there are many different techniques that are commonly used in therapy that can help people improve their sexual experiences and relationships. These techniques can vary depending on the individual's specific needs and goals, and also on the therapist's approach and training. Sexual education about sexuality, sexual anatomy, physiology, and function. Communication and intimacy building exercises, relationship skills training, sensate focus. This is a technique that involves touching and being touched in a non-sexual way. It can be done either alone or with one or several partners. The point is to increase intimacy and pleasure without the goal of sexual arousal or orgasm. Other techniques are relaxation and stress reduction techniques that help alleviate anxiety or performance pressure. Cognitive behavioral therapy. This is used to address negative thought patterns and behaviors that might be impacting sexual functions. Exercises to improve sexual function and performance, such as the Kegel exercises for women and penis pump use for men. Exploration of personal values, beliefs, and attitudes about sex and sexuality. Referrals to medical professionals for the evaluation and treatment of physical sexual dysfunctions with biological origins. These techniques are just a few examples of the techniques that may be used in sexual therapy. Your therapist will work with you to develop an individualist plan to address your specific needs and goals. First, only people with sexual problems seek out sex or sexual therapy. This is not true. Sex therapy can be helpful for anyone who wants to improve their sexual experiences or relationships, or who has concerns or questions about their sexuality. The second one, sex therapy is only for people who are unhappy with their sex lives. This is also not true. While sexual therapy can help people who are having problems end their sex lives, it can also be beneficial for people who are already satisfied with their sex lives, but they want to enhance them even further or explore more. Third, sex therapists are only qualified to help with physical problems. In fact, sex therapists or sexual therapists are trained to help with a wide range of issues related to sexuality. It also includes emotional, psychological, and relationship issues. As mentioned, different sexologists have different backgrounds and are specialized in different areas. 4. Sex therapy is embarrassing and invasive. So while sexual therapy may require you to discuss personal and intimate details of your sexual life, it is not embarrassing or invasive. Sex therapists are trained to create a safe, non-judgmental environment where you can feel comfortable discussing these topics. Also, you should never feel forced to disclose information that you are not ready to share. Number 5. Sex therapy is only for straight couples or heterosexuals. This is not true. Sexual therapy is for anyone. It can be helpful for people of any sexual orientation with any gender identity or relationship status. Many sexologists are specialized from a gender perspective, so they take into account all of these factors. 6. Sex therapy is a quick fix. Well, like other forms of therapy, sexual therapy can take time and effort in order to be effective. It is not a quick fix, but rather a process of exploration and discovery that can lead to lasting positive changes in your life, in your sexual life, and in your relationships. The process is seldom linear, and it is normal to go through some ups and downs along the way as well. The last one, sexologists offer sexual services. They do not. They offer guidance, conversation, and education about sexuality. To conclude the topic about sexuality, sexology, and sexual therapy, well, as you can see, it's a very wide and big area. In order to seek sexual therapy, you don't have to have like a very huge problem. It can also be exploration, curiosity, pretty much anything. So if you're considering it, there are no reason not to go. So feel welcome to do it. If you want to learn more with me and explore your sexuality with me, you can find me at CNews. They have a webpage, and you can either call the reception or book directly through the webpage. Thank you very much for listening. I hope you enjoyed it. You can go back and revisit some of the parts if you found it more interesting, and I hope it was helpful.